my notes remind me to thank you all for participating. And as a physician, sometimes I try to control my emotions too much, and I can't tell you how excited I am to have you all here and to be willing to work with us on the next phase of our process. As you know, we've completed the community health assessment. And these priority areas popped up out of that from our planning committee there, and now we're going into the community health improvement plan. And it really requires a collaborative effort, and that's why we want people from all of those organizations that Linda just showed you the slide of, and more, to come and participate with us. Over the last 2 years, we've been working as a community to improve the health of Southern Nevada by using Mobilizing for action through planning and partnership, which is we use the acronym MAPP for that. This framework, as shown in this slide, provides a roadmap for us to improve population health through a community and data-driven process. Today's meeting is the first of the second phase of that process, the CHIP, Community Health Improvement Plan planning process. And we want to address, and want you to help us address, the issues related to health here in the Valley. Our ultimate goal is shown on this slide. Through the MAPP process, community partners contribute to the development of this vision, and elements of a healthy Southern Nevada include an informed leadership, which you are, and we hope we are, public policy that supports health, access to resources and services such as high-quality health care, an effective public education system, a safe and supportive environment, and a healthy population. So what is a CHIP? It's a strategic plan for collaborative and collective action to improve health and the function of the public health system. And more generally, the health system, and even more generally, all of those aspects of things that relate to health, planning, transportation, and so on. So what we want to do is to build on existing partnerships and initiatives, and really to find and incorporate new partners, as you can help us to find those, strategically aligning resources and ensuring a collective impact. Key elements of collective impact are developing a common vision, shared measurements, continuous communication, and mutually reinforcing activities among all participants. So a CHIP is a nationally recognized process that is used by communities throughout the nation to set priorities and to coordinate and target resources. It's critical for developing strategic policies and actions that promote health within a community. And it provides us a plan for measuring the impact. So this slide shows 7 rows. I think if you look in this room, there are many more rowers and many more oars than we can possibly put on a slide like this to indicate. But having a CHIP is important and is a way to ensure that all the system partners are rowing in unison in order to more effectively reach a common vision. I actually plan to go on a kayaking trip or canoeing trip this summer. That only requires 2 people, one in the front to help steer, one in the back to power through. But ours requires so many more partners and effort than what just a simple little canoeing trip in the boundary waters of northern Minnesota will be. As we engage in this process, we need to constantly ask ourselves the following questions. Are we moving toward our agreed upon destination, our vision? Do we have the information we need to get to our destination? Do we have all the data we need to plan and implement change? I'll probably guarantee you that we don't, but we need your help to help us determine what may be lacking and where we may be able to get more data in the future. Is the lead organization effectively facilitating and guiding the process, and are we all rowing together? Is the system and the community working together?